Dr. Rogers, B. Rogers here is an economist whose research focuses on economic determinants of household food consumption, including price policy and food aid. She is a professor here at the Friedman School of Nutrition Science and Policy, and also the director of our Food and Nutrition Policy and Programming Division. Did I get that right? I know it's changed names.
Very close.
Okay, very close. Sorry about that. She has studied the effectiveness of cost effectiveness of alternative supplementary foods for the treatment and prevention of moderate acute malnutrition in children. And she works primarily in low-income countries and has worked in sub-Saharan Africa, South Asia, and Latin America. She's a leader in the development of interdisciplinary graduate education in food and nutrition and has conducted funded research on appropriate graduate training and for global nutrition and food policy professionals. So without further ado, I'll turn it over to B. Rogers and let you add anything else to your introduction that you'd like, but you can take it from here.
I guess I'm going to introduce this talk by saying that when I say I'm working on sustainability, everybody thinks of climate and ecology, and that's not what I'm going to talk about today. What I'm going to talk about is sustainability in the sense that the U.S. Agency for International Development, which is the foreign assistance branch of the State Department, implements development assistance programs that are food assisted. So the origin, I'm not going to get into it, but the origin of that program goes back to when we had lots of surplus food we were trying to get rid of. But in fact, the program has enormously evolved, and it's now part of the Bureau of Humanitarian Assistance funds what they call RIFSAs, Resilience Food Security Activities, that are supported by food it's no longer just a food program. And so what Jenny Coates and I, a colleague here at Tufts, we did a multi-country study ending in 2015 that was intended to identify what are the factors in the design of a program that makes the effects sustainable. So if there was behavior change, did it continue? If there were services provided, are they still being provided? Like that. And that report that we wrote, it was funded by AID, and it was 12 programs in 4 countries. And we came up with a set of recommendations for what does it take to make a food-assisted development program sustainable in my sense. So sustainable in the sense that the effects persist or continue. Now we are, I can't remember where it is in the slides. So we were asked after that, we were asked to work with Burkina Faso, and what you see is the beginning of the work that we did there. We were asked to go to Burkina Faso and assess the sustainability of impact, activity, behavior change of a program that they had implemented for 5 years. And when they did a follow-on, the commune of Kaya was not included in the follow-on. So that was a super opportunity to say, okay, you withdrew resources in 2018, and let's see what was sustained. So I'm going to show you the results of that study, but I'm also going to tell you that AID has now funded us to ask the following very scary question. When Jenny and I finished our report, AID adopted it basically whole hog, and they said, okay, from now on, any non-governmental organization that wants to implement one of these programs must develop a sustainability plan, and the sustainability plan must reflect the recommendations in this report. So that's very gratifying. And that's been in place since 2016. So we have a new grant, which I'm hoping will lead to some field work. But for now, we have a grant that is allowing us to look at how those requirements for a sustainability plan have evolved over the years, how the responses on the part of the non-governmental organizations have evolved in response to that change. And I'm hoping that a few years from now, when we have this event, I will be able to report on the very scary question, did it make a difference? Did the fact that they now ask people to consider sustainability, did that make a difference in terms of actual sustainability of those activities? So what I'm going to do is talk a little bit about this study, what we found about sustainability in the commune of Kaya in Burkina Faso. And this is just an overview of this talk. I've probably said already a lot of it. So the main issue is that impacts are often assessed at the end of a project. They do an end line evaluation, and they very, very seldom do an ex post evaluation 1, 2, 3 years after the project has ended. And so one of the things we found in our 2015, in the study that we ended in 2015, was impact at exit is not necessarily a predictor of impact 3 years out. That you can do things to beef up the impact of an activity that are not sustainable, and sometimes long-term sustainability is a trade-off against immediate demonstrable impact. So that's what we were trying to look at in this study in Kaya. So just to say, when we say sustainability, we mean that the activities that were started are continuing, that the positive, hopefully, impacts are still being felt, and that activities, if anything, have expanded, which we did see in some cases. And when we talk about exit, we're talking about when a program departs and it can stop supporting specific activities, but in our case, in Kaya, they basically departed from Kaya. And when I talk about an exit strategy, what that is the plan that the non-governmental organization, in this case ACDI VOCA, the plan that they had to make a transition and prepare the communities for their departure or exit. So this is the framework that Jenny and I developed as a result of that study we finished in 2015. We said that agencies implementing these programs need to develop an exit strategy. And one of the key elements, which isn't reflected on this, but I'm just going to say it, you should all remember it, is an exit strategy involves a gradual handover of responsibility from the staff of the agency that's implementing the program to individuals or organizations that are going to stay there. So the exit strategy is the plan that they have to actually prepare the communities where they were working for exit. And we said that sustained impact depends on behavior change being maintained or service provision and use being maintained. And that means that people must continue to have access to services. They must continue to have demand for the services, and the services must be delivered. And that depends on this mantra: motivation, resources, capacity, and often some kind of linkage to an organization that's going to persist. So linkage to the local government or a local NGO or some other organization, sometimes an academic institution like that. And this bar is very relevant to Burkina Faso because it says, look, things like a climate crisis or like a drought or a flood or a landslide could affect the best laid sustainability plans. And in the case of Burkina Faso, the other example that we talk about is terrorism and civil disturbance. So Burkina Faso is just south of Mali. There's, I don't know if you've heard of Boko Haram in Mali, but some of that terrorist activity has slopped over the border. And so in the last few years, there's been an increase in basically terrorism and civil disruption and a lack of security. And one of the things that we are concluding in our current study is that it isn't enough to throw up our hands and say, oh, well, they had really good plans, but there was terrorism and all bets are off. Or, oh, well, there was a drought and all bets are off. Because we have to recognize that these are countries that are subject to climate disruption and civil disruption. And so one of the things that we're working on now in our current sort of study is to what extent are agencies able to think about sustainability in the context of the potential for this kind of disruption. Okay, so what it says here is these motivation, resources, capacity have been critical, and gradual handover have been critical, and linkages in many, many cases. And I want to underline that it's not like you can say, oh, well, we sustained their motivation, that's enough. Or, oh, well, we sustained their capacity, that's enough. It's not. These three things, and I think you can see me circling them, right? Motivation, capacity, resources, all three need to be present in order to say that we have some confidence that the activities, impacts, behaviors will be sustained. And the comment that I'm going to make about the linkage partners is that if you say, okay, we're going to connect to a local NGO, or we're going to connect to a local government entity, or we're going to connect to something like that, the linkage partner has to have those same motivation, resources, and capacity to support continued activities. So the linkages are here like a fourth thing, but those linkages need to be thought about in terms of motivation, resources, and capacity. And one of the things we're finding, this is a preview of the 2028 Tufts Nutrition Data Symposium. But one of the things we're finding is that the proposals submitted by the implementing partners are identifying one or two, but not emphasizing you need all three. And I think we're going to see that. So where we did the study was in Burkina Faso, which is a landlocked country in sub-Saharan Africa, just south of Mali. And it began in 2011, it ended in 2018. And that's when they continued in other communes, but not in Kaya. Its goal was to reduce food insecurity, and it wanted to do that through promoting agricultural production and increase in income of households, both through agricultural production and sale and other livelihood activities. And then the third objective was to reduce chronic malnutrition. And that was done in part through the provision of supplementary feeding. In fact, we had a long relationship with this particular program, Tufts, because they had participated in a previous study where we were looking at the provision of supplementary foods and which foods seemed to be more effective at preventing stunting. Were there some foods that were more effective than others? To highlight, no. As long as they ate the food, it was effective. So I've already said this, when they implemented Vim Plus, they did not include Kaya. And so that gave us an opportunity to look at a location where they had departed while still having the sort of institutional support to work in that region. And so these were our objectives. We wanted to see whether the behavior changes in service delivery were still being sustained. And we wanted to see the degree to which shocks, particularly terrorism, had affected these activities. And I'm thinking in the future that we need to think about what things were able to overcome those shocks and were there lessons to be learned. So our goal, of course, is to be able to give advice about the future. And right now, I mentioned we have this follow-on study called Past Forward, and it's ongoing. So this is I've sort of laid this out. Starting in 2003, AID started to ask implementing partners to talk about sustainability, but they didn't provide any guidance until really concrete guidance until 2016, when they adopted the report that they funded our study and they adopted and I thought I had a slide on what we're doing now, which is that in 2016, they started requiring sustainability plans. We are now at the present, and we are reviewing the sustainability guidance and plans from 2016 through 2021 to see which of those recommendations were actually adopted. So I'm going to report on the study that we did in Kaya, and without going into great detail, we did a qualitative phase where we did qualitative interviews with the project team, with service providers, and with beneficiaries. And the beneficiaries were members of producer associations that were supposed to be promoting marketing of their crops, savings and loan committees, and mother care committees. And the service providers were mother leaders, and I don't know why it's not on this slide, mother leaders and community-based health agents who worked with pregnant and lactating women on childcare issues. Producer group leaders obviously had to do with agricultural production, and village vaccinators were trained to provide vaccination services for livestock and poultry. But then we did a quantitative phase where we interviewed a representative sample of households in the community. I don't think you care about all these details, but trust us, we were very responsible in selecting representative households to see what their experience was in being incorporated and being included in this program. And we followed that with a quantitative set of interviews with the service providers. So this describes the household, but then we also selected, it says here, providers, and asked them about their service provision. This is the study zone, qualitative, quantitative, and survey providers in Kaya. And in the qualitative, we interviewed beneficiaries, and I think in the interest of time, what I'm going to draw your attention to is pre and post. So we asked them how things were during their experience of VIM, and then we asked after VIM, and as you can see, the capacity building, the organizational capacities, the capacity to do radio production was all green, that means good, during VIM. And as you can see, the red is really bad. We didn't see any persistence of radio production. And that's because the radio stations had once they were being promoted once they were no longer being asked to do these informational radio shows, they just stopped doing them. But you can see that everything got a little worse, went from green to yellow or orange, whatever color you want to call that. And we have some quotes, but similarly with resources. So the agency provided materials, they provided funds, they provided inputs, so you can say provided food rations, which are the least sustainable thing you can do. And what you can see again is that where they provided materials for training, like one of the things that wasn't sustained was, we're going to train people on how they can produce more ecologically friendly stoves. Well, that requires materials. So as long as they were getting the materials and handing them out, they were, able to do that activity. But that was one of the things that really fell in the post-program assessment, simply because they didn't have those materials and they hadn't made a provision for providing it. One of the things that the motivation issue has to do with is, people aren't necessarily, they're happy with their little charcoal stoves. You say, oh, you could do better, we're going to give you the materials to make a better stove. They're very happy to take it, but they don't experience it as a problem to be solved. And so they're not going to go out and pay for those materials themselves. So those kinds of things, and the same thing with food rations, that we, the US government, provided supplementary feeding. When it was gone, it was gone. And the motivation then to make use, what the hope was that people would learn how great the services were at the local clinics where they went to get the rations. And so they would go even if the rations were discontinued. And that was their definition of what would make it sustainable. And so the linkages between the communities were established and maintained. The linkages among the different producer associations, not so bad. But interestingly, the links to market information were not sustained because the radio stations were supposed to be the dissemination channel, and they didn't have a motivation to continue. So they were the linkage partner, and the linkage partner didn't have the motivation. To our surprise, we were really surprised that the farmers told us that links that had been established with input suppliers, so people who would provide them with inputs, that those linkages were not sustained. And we really don't know why, because in other settings, those linkages have been sustained. The only guess we have is that transportation was scary in an era of terrorism, and maybe they weren't going to the market. But that's a big conundrum for us, and one worth pursuing. The motivation was sustained. We recognize that community development is good. We like to work because we like to do things out of recognition. But as you'll see, they cited that as being motivated to provide these kinds of services. But the real motivation, there's a quote here from one of the vaccinators were paid for their work. The community-based health agents were incorporated into the health system and paid for their work. And so they continued, whereas the volunteers were less likely to continue. And then one of the things that, I don't know if there's a thing here, but the issue with the shocks is that we found that even people who had not experienced any threat of terrorism, fear stopped them from going to meetings, from taking stuff to market. So the insecurity experience was only part of the effect of insecurity, because the fear was just as much of an intervening factor. So in terms of, I'm looking at the time. So I think I cut most of these results just because I wanted to allow time for the other pieces, but there were increases in the planting of the crops that were recommended. Again, why? Because they experienced a benefit. So they were motivated, and being able to produce more made them more willing to use the behaviors, make better use of the soil, make better use of water, things that they had been taught to do. Why? Because they were taught and they experienced a benefit. And so the benefit that they experienced allowed them to continue and expand. Big success with sorghum, which is largely a subsistence crop. They consume it more than they sell it. Millet, also a subsistence crop. Cowpea, also a subsistence crop. But you can see there was a big increase in peanuts, sesame, and sesame are largely cash crops. And they did experience sustainability there, and because they built capacity, the farmers were motivated by the experience of benefit, and they had the resources because their production increased. They could sell some and keep some, or keep their seed to increase their production, to continue increasing their production. In terms of receiving training, the provision of training largely fell. And again, that's because the people providing the training were no longer being, supported to provide that training. And it takes resources to provide training. It takes resources to benefit from training. You have to pay for transportation. You give up half a day or a day. And so these formal trainings on sanitation, nutrition, and health had, okay participation during VIM, but diminished quite a lot after VIM. And that's why, because the people providing that training were no longer supported to provide it, and the participants were no longer provided transportation. Okay, I'm going to. So the one thing I will say is that the things that were sustained or improved were things that did not require a lot of labor, that had clear benefits. Zy pits and manual tillage have clear benefits for production, and they don't require hiring labor, and they don't require buying a lot of resources or buying resources to buy inputs, and they have a clear benefit. So again, I think there are real lessons to be learned from which good agricultural practices were maintained and increased compared to those that were not. And the reasons, I think I'm going to not go through this, but I will say the reasons for abandoning certain practices had to do with it was too expensive or it wasn't available. So people who said using fertilizers, pesticides, and improved seeds and so on were too expensive was sort of the theme that ran through most of them. So increase in household income. One of the things we really would like to pursue is why the village savings and loan committees, they really were not, they had very low participation. Well, they had moderate participation during VIM, fell precipitously. And again, that's a model that we saw very successful in, well, for example, in Kenya, when we did our studies ending in 2015. So this establishment of village savings and loan that was a key strategy for increasing income of households And what we found when we came back 3 years later is that participation had dropped very significantly as opposed to other countries where we had actually seen it expand. So the strategic objective 3 that had to do with the reduction of chronic malnutrition, what we found was the follow-up, that way more households had access to latrines than did at that improved latrines. But other things, they were better than at baseline, but worse than at end line. And this may have to do with just encouragement and promotion. The thing about the latrines is that we don't know whether there were other programs that were providing those inputs. But in terms of improvements in diet, the diet diversity score was low and basically stayed low. The household, women's, and I don't want to really talk too much about the hunger one because the season, of course, affects that very greatly. So look at baseline, which was done in the hungry season, and look at follow-up, and don't look at end line because the end line was done in the harvest season. But you can see that we still saw at follow-up a significant number of people getting timely health checkups, and these had to do with women who received their supplements, women who received at least 4 prenatal visits. So these were indicators that showed that there was some lasting impact on maternal health and on health-seeking behavior, I should say. And the same with behaviors, completed vaccinations, number of children put to the breast right immediately after birth were well maintained. And the decline in getting supplements, we think, may have to do with people's reluctance to get on the road and go to a clinic. We can't for sure say that. Okay, I want to go. Oh, okay. So how are we doing on time? Not too well. Okay, I did want to talk about the service provider survey because I think it provided us some very important lessons. So there were 4 categories of service providers. There were community-based health agents who worked in the communities promoting growth monitoring and child health care and referring babies to clinics. And so you can see making meetings and home visits. And the strategy for sustainability for the community-based health agents was that they would be employed by the local public health system. That's key. The mother animators, the MLAs, had very similar responsibilities, organizing trainings, monitoring kids, monitoring children's growth and stuff like that. But they had a much higher attrition rate. And one of the things that doesn't show in this slide is that a lot of what they said that they were doing, they said, we will provide advice if people come to us, but we don't have the resources to provide group trainings and stuff like that. And if you go back to the quantitative household survey, the percentage of women who reported seeing their mother leader was only about under 20%, I think 18, who said, yes, we get visits from our mother leader. And that has to do, we believe, with the fact that the community-based health agents were in fact employed. They were picked up and paid to do their work. And the mother leaders were motivated by pride in their work, satisfaction of making a contribution, all of which they cited as motivating factors, but being remunerated was significant. And we saw the same thing with producer leaders, that the local farmers who were trained to provide agricultural technology information, they were less likely to continue particularly doing demonstration plots or farmer field schools after VIM exit, because they no longer were being given access to plots of land and inputs to use to demonstrate their value. Now, the village vaccinators were a different story. From the very beginning, they were encouraged to set themselves up as independent, I'm going to say entrepreneurs, and to provide vaccination for a fee. The fee was supposed to cover their time and motivation, and also give them resources so that they could buy new supplies. And so they did continue providing vaccination. They didn't continue with the trainings, and that's because the vaccination was a service that they were being paid for. So you can see that the community-based health agents did not reduce the time that they spent in their work, whereas the others did. And actually, even the village vaccinators were spending less time when we interviewed them than they were at the time of VIM. But these community-based health agents were basically, they were continuing to work because they were continuing to be supported. And as you can, I think you can see that the CBHA, the community-based health agents, talked about receiving compensation 3 times as, and the village vaccinators talked about pursuing the activity because they were being remunerated way more frequently than the MLAs and the producer leaders. And as you can see, they were employed. So basically, we got a lesson from the model of the CBHAs. We saw how important it is to provide continuous follow-up in order to keep people performing what was set up during the project. We know that the security crisis did have an impact on people being willing to attend meetings and people being willing to go to market. And then just the last point is that it takes time to embed behaviors and service provision into communities. And one of the concerns is these activities are typically 5 years. And if you're starting to do the transition in year 3, or in 4, you haven't had a whole lot of time to embed those practices into the communities. So we did see that there was the impact was less sustained in those groups that were incorporated later. That makes, to a certain extent, total sense. And as I mentioned, the agricultural practices that were maintained were those that didn't cost a lot, didn't require hiring labor or buying materials, and actually showed a benefit. And you can read as well as I can, but I think I've already summarized these conclusions. And so now we have a question of like 8 minutes? 8 minutes for questions.